Welcome back to the Morning Show here on the Rise News. The major problem afflicting the healthcare system in Nigeria is the brain drain of doctors. It is estimated that there is one doctor for every 5,000 patients, which is a far cry from the World Health Organization's recommended one doctor to 600 patients. Now, one of the reasons for the low numbers is that experts often leave the country in order to pursue their profession in countries with better infrastructure or higher wages. Joining us now to speak on this and what is being done in the industry is to improve the situation is the Secretary General of the Nigerian Medical Association, Dr. Olumiyiwa Odushote. Good morning, Dr. Odushote. Good to have you on the show this morning.
Good morning. Thank you for having me here.
Well, let's begin with, what has been on the front pages. It's the comments by the Minister of Labour and Productivity, Dr. Ngige. How do you respond to that? How do you rationalize his statement, considering that he is also a medical doctor? Would you say he's out of touch with reality?
Well, a lot has been said about his statement, and I would say it's unfortunate that he made that statement, and it gives an impression that he doesn't have a full grasp of the extent of the problem, because he appears not to even realize that there is a problem. And that is a very serious implication for a policymaker, because how then do we even start to think of how to resolve the problem if we don't even believe there is a problem? So I think it's a major issue which needs to be properly addressed.
Well, Dr. Odushote, the NMA had issued a statement challenging the truthfulness of what Dr. Ngige said. But Dr. Ngige, again, yesterday issued another statement in which he said, well, it might have been misquoted, but that he stands by what he said about the surplus number of doctors in Nigeria. And he indicated in that statement that he's a doctor himself. He has been a member of the Vision 2010 Committee on Health. He's been a senior medical officer and all of that. Is it possible that in the light of that statement, maybe there's some truth to what he said? Maybe the NMA has seen that statement and is likely to say, well, maybe Dr. Ngige is right. Or you insist also on your position?
Well, it's not about insisting on our position. It's about interrogating the facts on the ground. We are all aware that even the World Health Organization have done a lot of work, and the statistics are all over the place. And for somebody to say about 40,000, much less now, of doctors is enough to take care of almost 200 million nationals, is begging the question. It is obvious that most, like the former minister just said, who left this seat now, that most Nigerians have not even seen, a qualified doctor to treat them in the local area. Not to talk of even having not enough, So the question is, does he really know the true situation of things in Nigeria in the health sector? And I say it doesn't appear that it does.
Well, the statement released yesterday by the minister, buttressing his points, highlights lack of training for all who want to specialize. It's also a stand taken by the Minister of Health himself, Professor Isaac Adewale, last year to say there are not enough institutions to specialize, for doctors to specialize in those fields, and that, all doctors cannot all be specialists. Dr. Ngige is saying that for those who the system cannot absorb, they can find their way to where they can, find, better skills and better training. What is the current situation of specialization for medical doctors in Nigeria? What is the training situation like and the recruitment process at the moment?
Well, there are two issues here. Now, first issue is whether there is enough doctors to meet the health needs of Nigeria. And that we have already said there are not enough. Far, far, far from it. And the other issue is whether there are space for specialist training. I think, to me, that's a diversion from the real facts on the ground. You know, the situation now is, we are talking about universal health coverage, which is what the world is driving towards, that at least every citizen of the world must have access, you know, to the basic health care, you know, at a cost that is not catastrophic to his economy, to his personal economy. And that is the thrust of what government should be doing. And we believe that if government is doing the right thing, then government should be strategizing how to make sure that the best available hands are, you know, distributed in such a way that the citizens can have the best opportunities of accessing them. Now, the problem we have is maldistribution of even the limited number that is available. You know, and the reason is that government spends some money in training doctors, but did not put any plan in place on how to utilize them. It's like you build a factory, for example, a cement factory, and then you have no plan on how to distribute or sell the cement. It's going to become a failed investment. So what we are seeing is a failed investment in the health sector by previous governments. And this present government, with this current statement, does not appear to be going towards solving that problem. Now, the issue of adequacy of training, it boils down to the same issue. You know, you want to train doctors to be specialists. You have not created the environment. You have made inadequate facilities available. You have made the process very hostile. Then you have made it even very difficult for those who want to improve their skills so that they can deliver better quality service to the citizens. Extremely difficult. The true situation is that we have a lot of doctors who want to specialize, but there's no training area because government is not expanding capacity to train. And it's worse that even after training, they are not expanding capacity to utilize what they have trained. And maybe that's the reason why the Minister for Labor thinks that we have excess, because they are not doing enough to ensure that the capacity for utilization of the skills being produced are properly utilized. And that is the reason why other countries are utilizing this, even when they already have far, far more than the ratio of doctors to patients, than Nigeria. You know, they are still attracting Nigerian professionals to their countries because they understand the need to properly, utilize these professionals, which is one of the problems that we don't have. And I think it's a core duty of government to ensure that available resources are equitably distributed. One of the most vital resources of any country is the human resources. And I beg to say that the Nigerian government has not been able to adequately utilize its human resources. And that is why the migration is ongoing. And I hope it is not just starting.
Well, Dr. Odushota, one final question. In the statement by Dr. Ngige, there was a reference to the Nigerian Medical Association. He says that the NMA should be more concerned about carrying out a campaign, to persuade state governments to devote more funds and more attention to healthcare. Well, he didn't go as far as saying instead of the NMA engaging him, that you should do something more progressive in terms of engaging state governments. What's your response to that?
Well, again, I'm sure Nigerians are witness to the efforts that the NMA have been doing over the years in engaging governments, to be more responsive. And we've all seen how this has turned out. Government, instead of responding positively, have decided to criminalize the NMA, and encourage and sponsor negative publicity about the NMA. NMA was strongly behind the passage of the National Health Act and the signing of the National Health Act by the immediate past president. NMA has been on the forefront of fighting for the implementation of universal health coverage in Nigeria. NMA has been on the forefront of improving facility, in the health system of this country. NMA has been engaging all governors over the federation, to ensure that the right things are done. Beyond that, NMA has even gone out of his way to ensure that some of these things that he is saying, he is providing. For example, every 4 months, NMA holds a meeting around the country, and we ensure that we offer free services to the indigent population of Nigeria. You know, this is a part of walking the talk. NMA spends a lot of money in researching into the problem of this country, and we make proposals to government. We make advocacy visits, and we are not stopping, because until we get to the promised land, then it's not Eureka. The march is on, and we are asking for all Nigerians to rise up and join this march. Well, government needs to be more responsive. The federal government is accusing the state government of not playing their roles, and we can only but continue to push, you know, and the more Nigerians that join their voices to that, then perhaps the better results we'll get at the end of the day.
Thank you very much, Dr. Odushote. It's been very stimulating, having this conversation with you. Thank you.